start trying to. What's your name? What's your age? Inspect the patients for any kind of clinical signs like body habitus, scars, or wasting of muscles. Inspect the anterior, posterior, and lateral aspects of the shoulder joint. Shoulder joint palpation. Palpate the various components of the shoulder girdle, noting any swelling, bony irregularities, and tenderness. If the patient is known to have an issue with a particular shoulder, you should assess the normal shoulder first for comparison. Crossover test. Elevate the patient's arm to 90 degrees of flexion and then at maximum horizontal abduction. A positive test will produce pain on top of the shoulder near the AC joint. Apply scratch test. In this test, abduction and external rotations are measured by having the patient reach behind the head and touch the superior aspect of the opposite scapula. Knee impingement test. Use one hand to stabilize the patient's scapula, then bring the arm into maximal passive shoulder flexion. Hawkins impingement test. Elbow flex to 90 degree, then fixate the scapula with one hand and hold into the patient's elbow with the other hand and add passive internal rotation to the glenohumeral joint. Drop arm test. Bring the patient's affected arm into 90 degrees of abduction and external rotation passively. Then tell your patient to hold his position and release your supporting hand. Empty can test. In this test, the patient is tested at 90-degree elevation in the scapula plane and full internal rotation. The patient resists downward pressure exerted by the examiner at patient's elbow. Grip strength testing. We cross our hand with the patient and ask them to squeeze the hand. The purpose of the test is to measure the maximum isometric strength of the hand and forearm muscles. Finger strain test. Ask the patient to bend his thumb across the palm of his hand and bend the fingers down over his thumb and then tell him to bend his wrist towards the little finger. Thumb abduction test. Ask the patient to maximally flex his wrist within his pain margin while keeping his thumb fully extended and abducted. And apply a gradually increasing abduction resistance to the thumb. When a patient is unable to maintain the force against the examiner, the patient is free to release the pressure. Tinner's test. It is performed by lightly tapping over the nerve to elicit a sensation of tingling in the distribution of the nerve. Percussion is usually performed moving distal to proximal. Balance test. Ask your patient to flex his wrist maximally and hold the dorsal side of his hands together for 1 minute. The test is positive if the patient experiences tingling in the thumb, index finger, middle finger, and the lateral half of the ring finger, which indicates carpal tunnel syndrome by pressure in the median nerve. Bulge sign. Gently press just medial of the patella, then move the hand in the ascending motion, then press firmly on the lateral aspect of the knee. Commonly, no fluid will be found. Bulkman test. Ask the patient to lie with a fully extended leg, then stroke downwards just until you reach the suprapatellar pouch and press downwards with the other hand. Perform the same movement and stop just below the apex of the patella. While applying downward pressure, take one finger and press onto the patella and see whether it's floating or not. McMurray's test. Grasp the patient's heel with one hand and the joint line of the knee with the other hand. The knee is flexed maximally with external tibial rotation or internal tibial rotation. Valgus stress test. The examiner places one hand at the outside of the knee, acting as a pivot point, while the other hand is placed at the foot. The medial joint line is palpated while the examiner simultaneously applies an abducting force at the foot and a valgus force through the knee joint. Varus stress test. It is performed by stabilizing the femur and palpating the lateral joint line. The other hand provides a various stress to the angle. The test is performed at 0 degree and 20 to 30 degree, so the knee joint is in the closed packet position. Anterior drawer test. The examiner should sit on the foot of the patient's leg. Place a hand along each side of the patient's knee while palpating the joint line. Apply a posterior to anteriorly directed force through the superior tibia. Lachman test. The examiner bends the knee to about 15 degrees and slightly external rotation. Then by stabilizing the femur with one hand and putting the other hand behind the proximal tibia at the level of the joint line, and then the tibia is pulled forward. Posterior drawer sign. The examiner grasps the proximal lower leg approximately at the tibial plate or joint with the thumbs placed on the tibial tuberosity. Then the examiner attempts to translate the lower leg posteriorly.